Good morning to one and all present here. Myself Munawwardeep Kaur with my co-team members Inakshi, Paneet and Simranjeet. We are going to discuss our presentation on the topic training current employees. It includes training and its importance, contributing factors as an HRM issue, effects of lack of training, organizational responsibilities, laws and regulations needed for training, barriers and strategies to overcome the concern, and at last the summary. So starting with what is training? Training and development for the staff members is the approach of collaborating with the employees in enhancing their individual as well as the administrative competencies, expertise and the capabilities. So basically there are two types of training provided to the employees by their employers, which include in-house training and the external training. In the in-house training, the training is provided by the person who works inside their company regarding various soft skills, time management, quality assurance to the employees to get their more job satisfaction. And next one is the external training. In the external training, the employees have sent out of their organization to attend different seminars and meetings in which they can learn something new and can apply the same in their company to get the more job satisfaction and to achieve their goals. So next one is the importance of training. Why training is important for the current employees. So first one is to motivate the employees to enhance their personal growth, to achieve financial gains and high profitability, to reduce industrial accidents, to reduce employee turnover and to get the competitive advantages. All these things are interrelated. For example, if the client is well motivated, he works very efficiently for the company as well as for self, which helps in the personal growth as well as for the good for the company, which gives him a job satisfaction and reduce the employee turnover. Moving further towards the contributing factors as HRM issue, first one is the diversity. In an organization, people of diverse age group, cultures, and learning strategies work collaboratively to achieve their goal. But sometimes it's hard for the management to arrange different sessions for different learning style individuals so that they can learn efficiently. So next one is the changing workplace. Due to change in the nature of the work and workplace environment due to technological advancement, current employees do not have knowledge how they are going to utilize the new technology in their current job. Next one is the cost and the efficiency. A cost and efficiency in the department of the management, they have to plan a budget what amount they are going to spend on training new hires and the current employees, because a large portion of the budget is spent upon the arrangements for the training. Next is the fear of the failure and the resistance to the change. Some employers have the fear that they are not able to learn the new advancement and practice the same in their current job, and also they are more comfortable in their traditional way to do the job, so they become resilient and refuse any change. Further, poor communication sometimes act as an issue because due to the miscommunication between the management and the employees, that when they are going to provide the training, how they are going to provide regarding what kind of training they are going to provide to the employee and what is expected from them after the training, which lead towards the negative result in the job. And the last one is the unrealistic timelines. Management do not have any idea regarding how much time is needed for the particular training, because sometimes there is a group who needs more time regarding any training and to learn something about the current updates in the department. Thank you. And rest of the topic is covered by my friend Inakshi.
There are many negative effects if adequate training and development programs are not followed in an organization. Without proper training, there can be inconsistencies in the quality of work, which results in the low quality of work and which eventually leads in the low productivity of the organization. Hence, the clients or the customer may not get fully satisfied with the delivery of the services by the organization, which results in the poor relationship between the client and the organization. Moreover, the lack of training programs in the organization will give rise to the disengagement between the employees and also with the higher authorities. Hence, employees may feel undervalued and dissatisfied. And this stagnation of the job growth results in the downfall of the motivation in the employees, which eventually leads to the increased rate of turnover. In addition to this, in the absence of training, employees struggles to keep themselves updated with the new technologies, and this acts as a barrier in the organization's ability to innovate and grow further. Thus, the staff will stick to the old ways of doing their work, and which may not be a best way of doing that work in today's date. Therefore, this lack of knowledge and expertise will result in the increased chances of error in the practice of the employees. There are certain responsibilities at the part of the institution if they are introducing a new equipment in the hospital for the nurses, and these responsibilities are explained through a training framework in this presentation. Here we will talk about the ADDIE model. The most important step in the training is to select the best and appropriate model for the training purpose. The ADDIE model is a systematic approach for developing an effective training program. The first step, that is the analysis phase. In this, the assessment of the need of the introducing a new equipment is done. It also assesses the previous knowledge of the nurses on the importance and the uses of the introduction of the new equipment. In the design phase, organization has to look into that everybody has a different style of learning, that is audio, visual and kinesthetic. Therefore, while aggregating the study material for training purpose, inclusion of all types of resources, that is the audio visual media, should be done. This phase also focuses on the importance of having an effective communication within the organization, as scheduling the timing for delivery of the training program is also done in this phase. In the third phase, the content is organized and defined, and the material to be used in the workshops and the presentation is also created in this phase. In the implement phase, the delivery of the program is done. That is, nurses should be attending the workshops. Organization must have to make sure that there are qualified persons in the workshops who will be explaining the usage of the new equipment. Moreover, it is the organization responsibility to make sure that the staff gets enough time on hands-on practice on the new equipment so that any confusion can be addressed. In the evaluation phase, the emphasis is on the feedback. The organization must conduct evaluation to check and to identify the praises and condemnation of the staff towards the introduction of the equipment. This will help in further improvement of the organization's productivity. Finally, there are some key points that an organization should keep in mind during the training program. First, the introduction of a new equipment should solve the problems of the real world. For example, the EHR devices has helped in increasing the communication between the nurses and the physicians. Second, the training modules delivered should be practical enough so that it can be utilized in the real world scenario. Third, the training program should analyze that what nurses expect from the introduction of a new equipment and how it will enhance their practice. Fourth, the training programs should be interactive and creative so that learning can be enhanced and can be retained for a longer period of time. Fifth, the study material included should be able to demonstrate that how this equipment would be beneficial in any past experience. Sixth, during the training, the viewpoints of each member should be heard so that the achievement of goal can be done.
Next, we'll discuss about the laws and regulations for training new employees. Firstly, we'll discuss about the Canadian Occupational Health and Safety Act. Its main goal is to preserve workers' health, safety, and well-being by creating rights and responsibilities for the workers, supervisors, and the employees. It includes the following points.
First is the hazard identification and risk assessment. In this, the employers are responsible for identifying workplace hazards, assessing risks, and implementing measures to eliminate or control those risks to ensure a safe working environment. The second is employee rights and responsibilities. Employees have the right to know about workplace hazards, receive proper training, and participate in health and safety initiatives. They also have the responsibility to follow established health and safety procedures and report any hazards or incidents to their employer. The next is the workplace committees or health and safety representatives. Larger workplaces may require the establishment of joint health and safety committees or the appointment of health and safety representatives to facilitate communication and collaboration on workplace health and safety matters. The next is the training and education. Employers are required to provide appropriate training and education to employees on workplace hazards, safe work practices, and the proper use of the personal protective equipments. The next is the workplace inspections and investigations. Workplace inspections may be conducted by the health and safety representatives, workplace committees, or government inspectors to ensure compliance with health and safety standards. Employers must also investigate and report workplace incidents and accidents to the appropriate authorities. The next is the workplace violence and harassment prevention. Employers must take measures to prevent workplace violence and harassment, including implementing the policies, providing training, and establishing procedures for reporting and addressing the incidents. The last is the duty to accommodate. Employers have a duty to accommodate workers with disabilities or special needs to the point of undue hardship, ensuring equal access to employment opportunities and a safe work environment. Next, we'll discuss about the Employment Standards Act. It is a piece of legislation in many jurisdictions that sets out minimum employment standards and protects the rights of the employees. This covers the following areas. The first one is the minimum wage. The ESA typically establishes a minimum wage that employers must pay to their employees. This ensures that workers receive fair compensation for their work. The next is the hours of work. The ESA often regulates the maximum number of hours an employee can work in a day or a week, as well as the rules for breaks and rest periods. It aims to prevent excessive working hours and promote work-life balance. The next is the overtime pay. Many employment standards acts requires the employers to provide overtime pay to the employees who work beyond a certain number of hours in a day or a week. This helps compensate employees for additional work and incentivizes employers to distribute workload fairly. Next is the public holidays. The ESA usually specifies which public holidays are recognized and entitles employees to holiday pay or time off on those days depending on the local regulations. The next is the leaves of absence. Employment Standards Acts commonly include provision for various types of leaves, such as sick leave, maternity leave, parental leave, and many more. The next is the vacation time and pay. The ESA typically outlines the minimum amount of vacation time employees are entitled to based on their length of service. It also specifies the minimum vacation pay that employers must provide. The next is the termination and severance. The Employment Standard Acts often provide guidelines on notice of termination of or servant's pay when an employer terminates an employee's employment without just any cause. These provisions are intended to protect the workers from unfair dismissals. The next is the equal pay and non-discrimination. Many employment standards acts include provisions to ensure that the employees receive equal pay for work of equal value and are protected from discrimination based on factors such as gender, race, age, or disability. The last is the record keeping and pay slips. Employers are typically required to keep accurate records of the employees' hours worked, wages paid, and other relevant employment details. They are also required to provide employees with regular pay slips detailing their earnings and deductions. Understanding the ESA is essential for the employees to know their rights, ensure fair treatment with and take appropriate action if their rights are violated. It is advisable to familiarize oneself with the specific provisions of the ESA in their jurisdiction to have a clear understanding of their entitlements and protections in the workplace. Next is the continuous nursing development. It is essential for nurses to stay up to date with the latest advancements in the healthcare, maintain competency, and provide quality patient care. However, there are several barriers which can hinder the nurse's ability to engage in continuous professional development. The first one is the time constraints. Nurses working long shifts or multiple jobs may have limited time to attend the conferences, workshops, or pursue higher education. For example, if a nurse is working 12-hour shifts, she may find it difficult to allocate time for additional training during their days off. The next is the workload and staffing issues. High patient acuity and inadequate staffing levels can consume nurses' time and energy, leaving very little room for the professional development. For example, if a nurse is working in a busy intensive care unit with a high nurse to patient ratio, she may find it difficult to find a time for educational activities while she is working with the patient care. Next is the financial constraints. Costs associated with continuing education, such as the tuition fees, travel expenses, or the study materials, can be prohibited for the nurses. For example, if a nurse who wants to pursue a master's degree in nursing may face financial barriers if they are unable to secure scholarships or financial aid. The next is the lack of institutional support. Healthcare institutions may not allocate sufficient funding or resources for nurses' professional development. The next is the limited access to the training programs. Nurses located in rural or remote areas may have limited access to educational institutions or face challenges attending in person training events. For example, if a nurse is working in a remote clinic, she may have limited options for attending relevant conferences or workshops, which is due to the lack of nearby educational facilities. The next is a lack of awareness. Nurses may be unaware of available professional development opportunities or the importance of the continuous learning. For example, if a nurse may not be aware of certification programs or workshops that can enhance their skills and knowledge in a specific area of the practice. The next is the resistance to change. Some nurses may resist engaging in continuous development due to the compliancy or the lack of motivation to update their knowledge and skills. For instance, a nurse who has been practicing for several years may feel resistant to learning new technologies or evidence based practices. Next is the family and personal commitments. Nurses with caregiving responsibilities or other personal commitments may struggle to balance work and professional life, limiting their time and energy for professional development. The next is the inadequate mentorship and support. Lack of mentorship and guidance from experienced professionals can hinder nurses' motivation and ability to engage in continuous development. For instance, a nurse who lacks a supportive mentor may feel uncertain about the steps to take for professional growth or may not have the access to valuable networking opportunities. The last is the technological barriers. The limited access to technology or inadequate digital literacy skills can hinder the nurse's ability to engage in online learning platforms or utilize the digital resources for professional development. For example, a nurse who is not comfortable using computers or lacks reliable internet access may face the challenges in accessing the online courses or webinars. By recognizing and addressing all these barriers, healthcare organizations, nursing leaders, and the policymakers can create supportive environments that facilitate nurses' continuous professional development.
The first strategy is promote self care. In promoting self care, there are two types: time management and workload balance, and healthy lifestyle promotions. In time management and workload balance, encourage nurses to prioritize their tasks, delegate when appropriate, and set realistic goals. Help them develop effective time management strategies to balance their workload, avoid excessive overtime, and maintain a healthy work life balance. Peer support and monitoring. Establish peer support and networks or monitoring. Programs where nurses can connect with colleagues who provide guidance, advice, and emotional support. This creates a sense of community and foster a supportive environment. Healthy lifestyle promotions. Healthy lifestyle promotions which educate nurses about the importance of maintaining a healthy lifestyle, including regular exercise, nutritious diet, and sufficient sleep. Provide resources or wellness programs that promote healthy habits. Now the second strategy is retrieval, distributed, and interleaved practices. In retrieval practices involves actively recalling information from the memory, which enhances long-term retention and promotions deeper learning. In the nursing field, nurses can engage in retrieval practices by self-quizzing and self-based discussions. Second is distributed practices. Distributed practices involves spacing and learning sessions over time rather than cramming information in one sitting. It allows for better encoding and retention of knowledge. The third one is interleaved practices. Interleaved practices involves alternating between different topics or skills during the practices sessions. It promotes the learning transfer and help nurses develop the ability to apply knowledge flexibility. In the nursing field, nurses can apply interleaved practices by rotating clinical experiences, varied case scenarios. The next strategy is that how to overcome the work bullies. To overcome this barrier, there should be comfortable environment at work as nurses can comfortably speak with the HR professionals and managers. Second is encourage reporting and provide support. Encourage nurses to report incidents of bullying or harassments promptly and assure them that their concerns will be taken seriously. The other strategy is enabling nurses to assess education. First of all, the most important term should be explained to the nurses is stress management. Strategies can be explained like nurses should work in a team, as work can divide in a team in order to create the less stressful environment. The second is flexibility of time. There should be flexibility of time as it is another way to reduce the stress. The next strategy is motivational interviewing. In motivational interviewing, there are two types: set SMART goals and provide feedback and reflection. In set SMART goals, collaboratively set specific, measurable, achievable, relevant, and time bounded goals with the nurses. And second one is provide feedback and reflection. In this, offer constructive feedback to the nurses regarding their current practice and areas for improvement. The next one is providing a platform for further learning, and there are also two ways by which we can provide the further learning, namely continuing education program and e-learning platforms. In continuing education program, offer a range of continuing education programs, workshops, seminars, and conferences. And in e-learning platform, implement online learning platforms or learning management systems that offer a variety of nursing courses and resources. By these strategies, we can restrict the nurses from the barriers. First point is training is a very essential part in the job, and factors contributing to it as HRM issues like that budget, etc. are discussed in the presentation are interrelated and contributes towards the concern. Secondly, we have discussed that lack of training can result in poor relationships, low productivity, increased turnover and errors, not enough creativity, knowledge and skill gaps. Thirdly, we have analyzed that how ADDIE model can help an organization to complete their responsibilities in training. We have also discussed about the low-end regulations for training new employees, which include the Canadian Occupational Health Safety Act and Employment Standards Act. We also talked about the barriers which hinders the continuous nursing development. Lastly, we also discussed the strategies which can overcome the barriers that restrict the nurses from continuous development.